Welcome to 15 Minutes with Longevity. I'm Giselle Where Time Ames and I'm your host for this evening. As August is the month of women, it's Women's Month, we have in the studio with us this evening Dr. Trudy Smith. She is a gynaecological oncologist practicing at the University of Witwatersrand. Thank you for joining us here this evening.
My pleasure.
So we're going to really talk this evening about women's issues, specifically health issues around the more sensitive parts of the woman's body,
Sure.
the parts that a lot of people don't actually want to speak about. So what I wanted to ask you really was, what are the main health challenges that women face, or the main complications you see in women's health when it comes to the reproductive system?
So for us, the commonest cancer in reproductive organs is cervical cancer. And not many people talk about the poor cervix because it's in the vagina. And we don't really like to talk about vaginas that often.
We like to talk about the breast. There seems to be a lot of focus on women's breasts.
Absolutely. But cervical cancer, in fact, is second to breast cancer in commonality, but it's the leading cause of death of women in Africa. And for us, you know, it's a very, obviously it's my field of expert, but it's for us, we're very passionate about it and trying to, because it's a highly 100% preventable disease.
And how do we do that? I mean, you say it's preventable. And I mean, it's very interesting. We were speaking about it earlier, that there is this also media fixation. All these walks, all the fundraisers are all around breast cancer. And yet the one that we should be more worried about probably is this one. How do we take precautions, or how do we identify the risk?
So for us, obviously to go for regular pap smears would be important. And then there's primary prevention by vaccinating young girls in their pubertal or early puberty against human papillomavirus, which causes 100% of cervical cancers. So, and to go for your regular checkups. You see, it's very easy to feel your breasts regularly and to go for your mammogram, whereas you need to visit a practitioner in order to have your pap smear. And women should all go for their pap smears. Many women don't because they're always shy or embarrassed, and it's not very comfortable to go. But we need to go, and we need to encourage our daughters to go and also vaccinate our daughters.
And how often should you go for a pap smear test?
So once you become sexually active, certainly you should go. In South Africa, we go yearly. We have a government policy of a pap smear 3 in a lifetime at 30, 40 and 50 years of age.
Is that enough?
We would like it yearly, but you know, it's a huge thing to do, and it's a huge thing. We have to educate women about it. We have to get them to come back for their results and to check your result. And if your result is abnormal, that something gets done about it.
Now, the vaccine is very interesting, the HPV vaccine, because I've heard the Minister of Health talk about how important this vaccine is and how he would like to see a national rollout. And I understand that may actually come to fruition.
Yes, we're very excited about it. So it's gone to tender. It is available in the private sector. You would vaccinate your daughter. You can vaccinate your son as well, but you would vaccinate your daughter against 2 of the commonest human papillomaviruses that cause cervical cancer. They'll prevent 70% of cervical cancers, not 100%. So you still need to go for your pap smear, even though you're vaccinated. But we will see a decline in abnormal pap smears in those young girls that have been vaccinated.
And I understand that it may have an influence over other cancers as well.
Certainly. So throat cancer, vaginal cancer, anal cancer, vulvar cancer, which is the outside lips of that area, are all caused by human papillomavirus.
You were explaining to me about this virus that it's a common thing.
Absolutely. You can't avoid it. It's ubiquitous, as we call it. It lives everywhere. You know, everybody who's ever going to be sexually active probably will get HPV sometime in their life. And the younger you are, the more risk you are, or the more chance you are going to have HPV. But, you know, perhaps you're a little more sexually active than when you're older. But you can't avoid it. The only way you can avoid it is to never, ever, ever be sexually active, or have nothing ever go there, which is a bit difficult.
Yeah, but unrealistic probably.
Yeah.
Okay, so these are really important things that we have to be aware of and discuss with a health practitioner.
Absolutely.
And guard against. In terms of genetic testing, I mean, I was quite interested in, there's been a lot of media coverage around Angelina Jolie's decision to have a double mastectomy, and because she has this BRCA gene. Can you shed a little bit of light on, is this something for everyone? Is everyone at risk of a genetic kind of mutation?
BRCA gene, there are family lines of BRCA genes. So BRCA gene 1 and BRCA gene 2, they're not the only hereditary cancers that there are, but those are obviously the two that have come to light because of Angelina Jolie. She's a BRCA gene carrier, I think a BRCA1 carrier if I'm not mistaken. If you have a strong family history of young cancer sufferers like breast cancer, ovarian cancer, prostate in males, colon in females and males, these are common cancers. But so not everybody who's a breast cancer survivor is a BRCA gene carrier. In fact, probably 80% will not have BRCA gene. So BRCA gene is really hereditary family lines. You need to take a good history. You will have 2 immediate family members who were young breast cancer survivors. For instance, if you had breast cancer at the age of 29, not every 29-year-old with breast cancer has a family history or is a BRCA gene carrier, but they may be if they are, if you take a good history and you find somebody else in the family has it. But it doesn't only put, for instance, Angelina Jolie at risk of breast cancer, but also ovarian cancer.
That's right. And that you would have to remove your ovaries, which
absolutely,
the consequences are also very severe.
Absolutely.
So can we talk a little bit about that? I mean, when you remove your breasts, you can replace them.
Sure.
With, obviously, they're not natural breasts, but at least you can get some cosmetic repair done.
Mm-hmm.
But with the ovaries, what are the
ovaries
consequences?
are really important. There's a lot of controversy on the use of hormone replacement therapy in BRCA gene survivors. Or carriers, but certainly once you remove the ovaries, then that person becomes menopausal. So they will have a decrease in libido, hot flushes, dry vagina, dry skin, so other consequences. But having said that, ovarian cancer unfortunately presents much later because we don't really have a good screening test for it. Thank goodness it's a very rare cancer, so we don't have that many ovarian cancer sufferers. But it presents late and it requires chemotherapy, radical treatment, difficult to manage.
Okay, that's, I think, all that, when you read about celebrities having such a procedure, obviously it sheds a lot of light on a health issue. But I guess what it also plants in the minds of everyone is perhaps a little bit of fear around that could be them, and would they be able to do the same thing? In South Africa, are these tests available? Are women able to go and have a BRCA gene test?
Sure. So you wouldn't randomly go for a BRCA gene test. You need to go for genetic counselling. They're very expensive tests, so we usually recommend that patients go for genetic counselling. We have specific genetic counselling centres for instance, Johannesburg, Cape Town, in Pretoria, etc. They would have counselling. They would have their risk assessed. They would have their risk assessed according to a family gene line, and then we do have availability of the genetic test in South Africa. If it needs further testing beyond what we think is a South African genetic line, it would, for instance, go to the United Kingdom, where they would be able to test for even more family lines.
So countries and families have very specific
Absolutely.
traits.
Absolutely. Oh. And obviously it's a global village, yes. So people travel, etc. So, that's why a genetic counsellor is important, because they would go through all of those. You just don't go for an arbitrary BRCA gene test. You need to go through a genetic...
The whole process.
Absolutely.
I want to ask you, do you think we are winning the war in terms of raising awareness around cancer, specifically in women, and precautionary measures around it? Do you think there is enough awareness, and that there is enough done to help women understand generally? And again, I think the market or the environment we live in is, we live in a very schizophrenic society where the private sector, I think there's a lot of awareness around health issues. Absolutely. And then the mainstream public or the broader community, there's less.
I think there's never enough awareness, and I think it's important for us to continue to grow the awareness. Certainly there's more now than there was, for instance, 10 years ago, and women were often shunned and not encouraged to go for cervical smearing, for testing, to have a health check if things aren't good. And they can go to their local clinic if they're in a government setting or don't have healthcare insurance. I think that we never have won the battle. We need to continue to fight in order to make awareness for all women that they are able to go for a cervical smear. They are able to protect themselves against many diseases.
And the relationship between being HIV positive and some of these cancers, is there?
Certainly, if you're HIV positive, you're much more likely, or certainly your risk of getting a cancer that is precipitated by, for instance, other viruses, like the human papilloma virus is more common in HIV positive patients, but being HIV negative, you can also get cervical cancer. So it just makes you more at risk. We know from trials that we've done that HIV positive patients get cervical cancer 10 years younger than do HIV negative patients. Okay. So we're starting to see a lot more cervical cancer in younger women, age 30 to 40, as opposed to the 40 to 50 age group.
And that seems to be, I wouldn't say general trend, but we are seeing more and more reports of younger women getting also breast cancers in these, which we didn't see before. Is that a case of just not being reported? So it was underreported, now all of a sudden with more awareness, with more health information, we're seeing this? Or is this just an actual trend?
I'm not so sure that it's an actual trend. I think our ability to diagnose and our ability of patients seeking healthcare earlier is important, and that has increased our incidence because people are presenting earlier. What is quite interesting is we also did a trial where women saw 5 healthcare practitioners before the diagnosis of cervical cancer was made. So I think I would encourage women that if you have abnormal bleeding and it's not solved, you must persist until somebody actually solves the problem for you.
And is there a link between any of the gynaecological, the sexually transmitted diseases like herpes and the chlamydias, warts, genital warts, and some of the cancers?
No, except that if you have a sexually transmitted disease, you're more likely to become at risk of HIV infection, and that obviously would put you at risk of HPV infection. Genital warts are caused by human papilloma virus, but they're a different type. They are type 6 and 11, which do not turn into a cancer. But having said that, if you have HPV 6 and 11, you may have the other HPV types, which could cause a cancer. But just because you have HPV doesn't mean you have cancer. And that's also an important message to go out there, is that you need the HPV to integrate into the cell and to cause problems with the cells to cause the cancer. So you could be HPV positive and not have cancer. You know, but Dr. Google unfortunately gives you cancer before you've got it. And many women are afraid of that, but it just means you need to have a more stringent checkup.
So talking about that, what's your advice to women around how we can be more conscious, how we can improve our reproductive health?
I think you need to examine your breasts on a regular basis. You need to go for your annual pap smears, or certainly as many as is allowed by your healthcare insurance, etc. And that you're going to vaccinate your young girls, and that any abnormal bleeding or abnormal discharge, you're going to seek healthcare advice.
Well, that's it for tonight. Thank you for joining us. I hope you'll tune in next week when we'll be discussing the great fertility debate, as well as how infertility can affect a person on more than just a physical level. Stay well, be healthy, and I hope to see you here next week for your dose of health news. Good night.